A good smile goes a long way, but if you're in need of service to get your teeth in tip-top shape, there's a local dentist who wants to help. Let's now welcome Dr. Shala Stateri of All Smiles Dental in Fresno. Welcome, doctor. How are you?
Thank you. I'm fine.
Oh, doctor, we have to start with, I like starting with, your history. How did you get into dentistry, first of all?
I guess I always had a dental issues, problems myself, and I was so scared. I was so scared. Dentist started the wrong way with no anesthetic, doing a bunch of filling, all very, very bad memory. So for so many years, I didn't even want to go to any dentist. So at age 18, finally, my family, they insisted, and we found a female dentist who was so gentle and so loving and patient with me. And I got that picture, and I said, if she could make me that feeling good, so good, I got to do this to somebody. And from then on, I was 18 years old. I had to go through so many ups and downs. Finally, I went to Chicago, Northwestern University, and I started dentistry. I finished my undergrad at University of Illinois. Yeah, and then.
So for how long have you been here in Fresno?
We moved to Fresno in 1991 because of my husband getting a position in here, but I am graduating in Chicago in 1989 from Northwestern. And then we moved down here. I had to start taking the state boards and all over, and I have 3 children. They were very, very young back then. And it took me some time because in Fresno, you had to go to San Francisco or LA, find a patient, get your stuff. And finally, I passed the board in 1990, I believe, and then I started working here and there. And since 1996, I've been on my own.
Well,
I
good,
started
because now we have a great
office.
dentist here in Fresno,
Thank
right?
you, thank you. I try to.
Doctor, how important is it for people to take care of their teeth? It's something really
very important,
right?
very. And then the sooner you start in your life, the better it is, because most people, when you ask them, when was the last time you go to dentist, they say, I don't need to. Just because they don't have a toothache, it doesn't mean that you don't go to dentist. And when something is hurting, it's almost late. It's either your root canal or you need extraction. Hopefully we want to start with preventive, which is exam X-ray cleaning and bleaching and stuff like that. And I know personally, it took me time to understand what's going on. And right now, I'm not, you know, when you graduate from dentistry, you just look at teeth, bunch of, they just make you look at what is wrong in this tooth, what is wrong. But then, especially this last few years, I've been thinking, because I have a lot of TMJ problems, and I see a lot of people who come to the office with this problem, and then you get exposed to
doctor,
sleep.
What is that, if you don't mind me asking?
Temporomandibular joints, your joints in here.
Okay.
And then I realized that it's not just the teeth that you're worried about. Yeah. You can have cavity problem, which is on teeth, clinic problem, which is periodontal problem, or bite problem. We totally ignore bite problem, which is the worst problem because it's very confusing. And then the source of bite problem is your jaw. Yeah. And how your jaw on both sides, they have to be balanced. This little mystery takes care of the whole health of the body. And then nowadays we take picture of the patient's face besides the teeth, and then the shoulders and how you walk, all these muscles are connected. Wow. And then I noticed that a lot of people come and just complain about while we are doing the work, they've fallen asleep. Yes. And then I realized that I took so many classes. Lack of oxygen during the sleep causes sleep apnea. Why? Because of the airway problem. We never looked at it this way. And now you see that these teeth are connected to all these muscles connected to this jaw, and it's causing your sleep apnea, it's causing your TMJ problem, it's causing your bite problem. which, by the way, it grinds your teeth.
That is so
and then you
interesting.
get cavities.
It
Yeah.
really is, because people don't think of that. They sometimes think, oh,
No.
maybe it's just something else, but they
No,
never
that's
connect it
what
to
I'm
your
saying.
teeth, to this part.
Yeah.
That is really interesting to know, doctor. And doctor, I'm pretty sure that that's one of the services you offer, right?
Yes.
What other services do you have?
Well, as I said, I'm a general dentist. I am doing normal general dentistry, cavity cleaning, you name it, root canal to up to a certain point. From my skill, the ability is. When I look at the X-ray, I just feel like, okay, we should do this. Or I have a very good team. I refer my patient to endodontist for the back teeth, for curved roots, and then for implant, for example, I have a good team, oral surgery group. I send the patient for implant, and they come back. I do the crown over the implant. So we do basic things, but my diagnosis doesn't stop just at the teeth. My diagnosis, it goes to how you chew, how you bite, and when you bite, does your jaw click? If it clicks, why? And lately, I'm doing some orthodontic work. Again, orthodontic work is not just all about straightening the teeth. It's about
there's so many things that you
it's just you have to coordinate these teeth with the way you're biting and
doctor, for the people that are watching right now, they could find you at in Fresno, right?
Right.
Because I'm pretty sure people are watching and they want to go to your place, right?
I hope, yeah.
No.
I try to give this service to people. Our office is located 2 blocks north of Kaiser Permanente in Fresno and Alluvial.
There we go.
There's a shopping center, and we're right on the 2nd floor.
Perfect. Thank you so much, doctor, for being here with us. Thank you. There you guys have it.